Hi there. My name's Carrie. I'm the Coffee and Conversation Counselor. I have a private practice in Riverview, New Brunswick, where I work with individuals and groups to support their mental health needs, in particular their mental health well-being as it relates to compassion fatigue, compassion satisfaction, vicarious traumatization, and professional burnout. So I'm really grateful to be here with you, and I hope that the next 60 minutes will give you some tips as we explore resilience and radical self-care for nurses in the recovery phase of COVID-19 in New Brunswick. So welcome. So what do we know? Well, distress is not new to nurses. It is part of your normal routine. It's part of your normal work. As nurses, you experience days where people are sick and can't be cured, where you witness pain and suffering and death. And you may expect this as part of your role and are ultimately accustomed to it happening and to witnessing it. You may even feel a sense of privilege at being able to be there for people at these most challenging moments of grief, pain, loss, and suffering. COVID-19, however, has changed much of that. Over the last several months, you may have been experiencing pressure, fear, exhaustion, isolation, ongoing emotional distress, and even trauma. Your mental well-being as nurses, as healthcare providers, has been put to the test. In addition to post-traumatic stress, the trauma, the potentially traumatic events that you are experiencing during COVID-19 may also lead to symptoms of depression or anxiety, as well as significant mental health concerns, including compassion fatigue, moral injury, traumatic grief, or burnout. The prolonged and recurring nature of this virus and the trauma related to it may increase your risk for subsequent related mental health concerns. And even the most highly experienced nurses and the most resilient among you may be overwhelmed. You may be overwhelmed by the fear, by the isolation, by the grief, and by the potential of loss of life. And although not all nurses will develop mental health concerns, no one is completely invulnerable, completely immune, and some will struggle, potentially for an extended time. So as we move as a province through the recovery and reopening phase here in New Brunswick, the question is, how will you transition? How will you transition from being on the front line of the viral battle to this new normal? Over the next hour, we're going to spend some time highlighting key strategies for building moral resilience and encouraging radical self-care as we move into the recovery phase across the province and supporting you as our primary healthcare providers. So we're going to talk about compassion. We're going to talk about compassion fatigue. We're going to talk about moral distress, moral resilience. We're going to talk about the risk factors, and we're going to explore radical self-care. So, what's on your plate? What's on your plate today? I'm willing to bet that in addition to spending this hour here over your lunch break on an evening on a Saturday morning, that you also have a calendar filled to the brim with other life events, work activities, homeschooling, your own medical appointments, grocery shopping, and the ever-present responsibilities of everyday life like cooking, cleaning, making beds, taking out the garbage, doing the dishes, walking the dog. That's a lot. And the COVID-19 crisis creates unprecedented challenges for those of you in healthcare, for those of you on the front lines of care. These might include insufficient supplies, particularly of PPE, maybe shortages of life-saving equipment, which fortunately here in New Brunswick has not been an issue, but it certainly has been one of concern. Perhaps compromised standards of care, and your professional duty colliding and being in conflict with your own personal health and safety concerns. Before we dive into all of that, let's breathe. Let's just take a moment. Each of you is already well versed in human anatomy and physiology and all the various systems that function within the human body. And as we know, the autonomic nervous system is the branch of the nervous system that carries out the vital functions of the heart, the lungs, the circulatory system, the glandular system, all without our conscious control. And of course, it's further divided into the sympathetic and parasympathetic nervous systems. When we stimulate either one of these branches, they occur without conscious awareness, and they occur through our activities, sleeping, eating, exercising, or through our mental processes, having stressful thoughts or peaceful thoughts. The sympathetic nervous system, of course, mediates our body's response to physical activity by increasing our heart rate, muscle tone, sweat secretion, pupil dilation, other functions like that. And in short, it really helps the body gear up for physical exertion. And it's responsible for our fight-flight mode of organisms. Conversely, the parasympathetic system does the opposite work. It decreases the heart rate, decreases blood pressure, skeletal muscle tone, prepares our body for rest, for sleep, for digestion. I want to talk about those two things, but I want to talk about them in context of the vagus nerve, because it is the main effector and effector of the parasympathetic nervous system. So when we stimulate the vagus nerve, it helps us. And stimulation occurs during each cycle of the breath. So inhalation emphasizes sympathetic activity, the stress exercise branch. The exhalation stimulates the parasympathetic activity. So by adjusting our ratio of inhalation to exhalation, we can actually adjust the relative emphasis given to either the sympathetic or parasympathetic system. Why is this important? Why? Because there is evidence that stimulating the vagus nerve actually helps us activate that parasympathetic system, reduce the production of cortisol, and suppress inflammation. It's an anti-inflammatory reflex. That's pretty cool. So how do we do it? So this is going to be your first tip. We practice breathing. We're going to inhale for half as long as we exhale. So you notice on the screen it says 4, 7, 8. I want you to inhale through your nose on a count of 4. Hold that breath for a count of 7 and release that breath for a count of 8. So it looks something like this. Did you notice a change in my body? Did you notice how my shoulders dropped, how my chest opened, how even my jaw slackened? One simple cycle of, focused breathing helped release. So practicing that breathing on the regular basis can help us with our stress response. A great way to practice this is while washing your hands. Now, I know that in healthcare, we wash our hands for more than 20 seconds, but the gold standard currently, being promoted by various health organizations is 20 seconds. 4, 7, 8 adds up to 19. So what a perfect time to incorporate this mindful vagus breathing into our daily routines, because I know you all wash your hands multiple times a day. So by incorporating it here, we're not adding anything extra to your day. You're just incorporating something new while you're doing another activity. That's our first tip. We breathe. We breathe because it shows compassion. It shows us compassion. So let's explore that concept a little bit. How do we define it? How do we actually define compassion? Well, the Oxford Dictionary suggests that compassion is the feeling or emotion when a person is moved by the suffering or distress of another and by the desire to relieve it. It's a pity that inclines one to spare or succor. Anna Seppala describes compassion as the emotional response we experience when we perceive suffering, and it involves an authentic desire to help. I love that. An authentic desire to help. Ultimately, compassion involves two different things: identifying with the human suffering and that desire or motivation to relieve that suffering. How does that relate to nursing? Well, I took some time and I looked up the Code of Ethics for nurses here in Canada. And I thought it was really interesting. Nursing values and ethical responsibilities are described. And they're described as being central to ethical nursing practice. The 7 primary values are, and I'm going to read directly: providing safe, compassionate, competent, and ethical care, promoting health and well-being, promoting and respecting informed decision-making, honoring dignity, maintaining privacy and confidentiality, promoting justice, and being accountable. I think that's really interesting. That's from the Canadian Nurses Association Code of Ethics for Registered Nurses, and that's the 2017 version, and I pulled that from the Nurses Association of New Brunswick 2019 Standards of Practice. The first thing talks about compassionate care. None of you went into nursing thinking you wanted to avoid being compassionate. None of you went into nursing anticipating that you would not derive satisfaction from helping others. And so compassion satisfaction is an important part of your work, and it's an important part of maintaining a sense of resilience. The Professional Quality of Life Screening Tool, which is an excellent tool that can be used to determine where you're sitting in regards to your profession, describes compassion satisfaction as the pleasure you derive from being able to do your work well. For example, you may feel like it's a pleasure to help others through your work. You may feel positively about your colleagues or about your ability to contribute to the work setting or even to the greater good of society. And isn't that interesting? The greater good, an ability to contribute. It's also described in the book Overexposed as the satisfaction of working with people and expressing your compassion and your empathy. The sense of doing the right thing, helping people. I'm doing the right things. So that's very interesting, right? The compassion is not just about feeling, but it's also about a sense of rightness, of ethics. Other people describe compassion satisfaction as, I like helping people get better. It's really wonderful. They talk about making a difference. I made it better. I'm in the right profession. I should be here. That the rewards outweigh the challenges, and that there really is no other feeling that can compare to helping someone who is truly struggling. I can really appreciate that sense of feeling committed and connected when someone gets better. Compassion has all kinds of rewards. It leads to greater connection. And as humans, we're designed for connection. We're created to be connected to others. And connection through research, because I love evidence-based stuff, I like research-based materials, connection correlates to better mental and physical health. It correlates to a speedier recovery from disease. You've seen that. It correlates to a lengthened lifespan. And I know that those of you who have worked in compassionate care can see that your patients who have a strong connection, who have those strong social ties, that strong support system, seem to recover faster. They have a greater sense of hope, a greater sense of resiliency. So when we choose work that allows us to feel connected, then we're doing these wonderful things for ourselves. It leads to a strengthened immune system. Our self-esteem is bolstered. Of course we feel good. When we feel good, we have a lower risk of anxiety and depression, and it increases ultimately our empathy. It increases our trust, our cooperation with others, which in turn leads to greater connection. So this is a beautiful cycle that is enacted through compassion. But then reality sets in. What happens when we get out there? We're trying so hard to stay healthy. Maybe we're traveling for work. Maybe we're experiencing vicarious traumatization. We're dealing with the regulations, the licensure, the inspections. There's a sense of disconnect. You're trying so hard to have healthy meals, and I know what it's like. You have differentiated roles. Maybe you started off thinking you were going to be a hands-on nurse, and now you're a nurse manager. Maybe you're in administration. Maybe you're in research, or the opposites. You're struggling to balance and juggle your own family commitments. So look at your work. Look at your lifestyle. Do they support your compassion and satisfaction? Do they support your personal well-being? Well, let's look at the risk factors. Among the risk factors are no awareness of compassion fatigue or of moral distress. We just didn't know that it was a thing. Perhaps overexposure, right? And that's part of what we were talking about earlier when we were talking about the risks associated with the coronavirus, with COVID-19. Perhaps you're very early in your career or very, very late in your career. Perhaps you lack adequate training or you have inadequate supervision. Maybe, depending on where you are, there's a lack of organizational recognition or protective factors when it comes to compassion fatigue and moral distress. Maybe your workplace has unrealistic demands. Maybe there's a lack of boundaries. Your own personal histories can be a factor. Perhaps you have a lack of self-regulation skills. You practice a high-stress work style. I'm going to wager a guess, and I do work with a lot of nurses in my private practice. I'm going to wager a guess that many of you watching do have a high-stress work style. So let's explore that for a moment, shall we? And I'd be saying, like, hands up, identify which ones. A high-stress work style is one in which you find that you become easily angered or hostile. A person who practices a high-stress work style is often speaking rapidly, guilty, is irritable and impatient, perhaps sees others as enemies, competitors, barriers to your own success, often experiences a really strong sense of time urgency or a need to multitask, which we know is not actually efficient. But we also know that it can be the reality depending on where you're practicing nursing. Someone with a high-stress work style is competitive, driven to achieve, has very high goals, and gets angry when they're not met. Perhaps obsessed with numbers, metrics, measure success in terms of how much, how many. Notices that their body is tense, stomach in knots, clenched jaw, tight lips, muscles, everything is clenched. Perhaps sitting on the edge of the chair constantly, eating quickly, fidgeting a lot, noticing an increased heart rate, perspiration, cutting off other people's speech, finishing their sentences for them, and simply not demonstrating a concern for others in your workplace. I know I've been guilty of most of those at one time or another. And that leads us to being at greater risk for compassion fatigue. Compassion fatigue is ultimately characterized by that deep physical and emotional exhaustion, right? And a pronounced change in our ability to feel empathy for our patients, our loved ones, our coworkers. You feel it. You feel it in your body. You feel that complete lack of excitement for your work. Ugh, I have to go to work. You're tired all the time. You begin to avoid things. You avoid your family. You avoid your friends. You avoid conversations with colleagues. You find yourself calling in sick, just dialing it in, experiencing more migraines, more colds, more flus. You may find yourself turning to emotional eating, using alcohol or other drugs, binge watching Netflix, Prime. Some deep and excessive sleep, a loss of hope, living in zombie mode, just going through the motions to get her done. You may feel a sense of numbness. You just don't care anymore. You have no more empathy, nothing left. this is when we know that we've hit compassion fatigue. One person described it as when you have given so much, there's nothing left. It occurs when we are completely overexposed to pain and suffering. Because of your kindness, your compassion, and your empathy, you begin to absorb the emotions and reactions of the people you're helping. You become that sponge who's never rinsed out and laid out to refresh. Compassion fatigue is that cumulative toll that we as individuals experience as a result of exposure to the suffering, to the hardship, to the crisis, to the trauma. It's the result of too many demands, not enough personal and professional resiliency, and it is ultimately a predictable phenomenon. It's where we just listening to this stuff, seeing this stuff day after day and feeling hopeless and helpless, and your being there isn't changing anything. That's compassion fatigue. In the case of COVID-19, in the case of this global pandemic, compassion fatigue may be amplified or exacerbated or accompanied even by moral distress. And that term, moral distress, was first coined by an ethicist back in, I'm going to say, early 80s, Andrew Jameson, to describe the negative feelings that arise when we decide on a morally correct action in a given situation, but we are actually prevented, for whatever reason, from taking that action. Okay? And he identifies two very distinct components to moral distress. The first is that initial distress that's experienced in real time as the situation unfolds. The second is called reactive distress, and this is what arises after the situation has passed. It involves that lingering feeling about your own failure to act on the initial distress. And this reactive distress is sometimes more referred to as moral residue and can be associated with a loss of personal moral identity and with long-term adverse consequences. So it's important to note that moral distress differs from other kinds of stress and from related phenomena such as burnout and compassion fatigue, because moral distress occurs when we recognize that we have a moral responsibility in any given situation, we evaluate the various courses of action, we identify in accordance with our own beliefs the morally correct decision, but then it is prevented from following through. Moral distress involves the violation of our core values, our core moral values. It has the capacity to erode our personal integrity, undermine our moral identity. At its heart, it is a type of suffering that arises in response to the challenges, the threats to, the violations of our professional and personal integrity. And there is an abundance, like just a plethora of research indicating that moral distress is a widespread problem in healthcare. Not just among nurses, but among physicians, pharmacists, therapists, social workers, and so on and so on and so on. And while the reported intensity of this distress varies, at least one study has found that nurses, in particular, experience moderate to high levels of moral distress on a regular basis. So add in the impact of a global pandemic, and we absolutely know that COVID-19 is causing ethically complex scenarios for you. That, for example, situations where extreme resource limitations that may be affecting patient care or the safety of your healthcare team is causing distress. You have that sense that you're in conflict all the time and you feel unable to fulfill your ethically appropriate course of action. And this image just resonates with me because it makes me think of like the brain being just so conflicted, a storm happening between heart and brain and ethics and corporate responsibility. And it must be so exhausting. There are specific elements that are common to moral distress. The first is a sense of being complicit in wrongdoing. Yeah, we believe that we're doing the wrong thing, but we really feel we have very little power to change the situation. You may feel that you have a lack of voice. That's, you believe that you have insights and knowledge relevant to the situation, but they are either not heard or they're not taken seriously. There is a sense of wrongdoing associated with professional values. This is when your professional standards of care are impossible to carry out. For example, when care or services are being rationed, when resources or supplies are being rationed, when resources are not yet available for vulnerable people. And then there's that sense of repeated experience, that day after day, incident after incident, situation after situation, you're experiencing these moral distressors and you are left with that moral residue, that heightened sense of moral distress in subsequent experiences, layering. So in nursing, Rodney, 2017, described moral distress as arising when nurses are unable to act according to their moral judgment. And I've heard this a lot from nurses that I work from, but I know that we're hearing it more and more in this particular time. You may know the right thing to do, but the system structures or other limitations make it nearly impossible to pursue the right course of action. And that can lead to those negative consequences, which are further described, such as anger, frustration, guilt. However, good news, it can also be a catalyst for self-reflection, for growth, for advocacy. If we don't address it, moral distress is related to higher incidence of burnout, compassion fatigue, depression, errors in patient care, a distancing emotionally and mentally from patients, and decreased job satisfaction. Sometimes in the nursing profession, we use the term to reflect experiences of working within the traditional hierarchies of decision-making. For example, you may feel very certain that you know the right thing to do, but you're constrained by carrying out the physician's orders. Or you have to abide by other people's policies, which make it impossible to pursue the action that you know to be right, morally right. Others in healthcare certainly experience this due to power differentials or other obstacles. And when you, as a nurse, are uncertain about the rightness of an action, for example, taking someone off life support, the decision is equally morally hard, and it can cause deep distress to arise out of having to make those decisions. Allocations of resources can lead to problems with unsafe staffing, unsafe practices, and sometimes almost a subsequent kind of code of silence around not speaking out or reporting mistakes. And these are all factors that contribute to our moral distress. And during COVID-19, nurses are facing unique situations, things that they have not encountered before, because none of us was trained in how to live through and work through and give good care through a global pandemic. There are now really strictly limited hospital visitation policies that are preventing you as a nurse from involving families in care decisions. Or maybe you're a community nurse, and isolation measures are resulting in patients dying alone without family physically present. Perhaps you're the only person with them. We're seeing dire situations where patients may be denied potentially life-saving therapies due to shortages or restrictions. This leads to moral distress. So how do you know, how do you as an individual recognize if you're experiencing moral distress? Well, not everyone is going to experience this in the same way, right? Because none of us is the same. Each of us is unique. And depending on the person and the event, it can range from being very easily manageable to being completely impairing, debilitating. There have been studies that show that moral distress can be physical, headaches, fatigue, impaired sleep. It can be emotional. It can be behavioral, like drinking more, eating improperly, maybe controlling behavior, engaging in cynicism, and so on. So I'm going to challenge you to ask yourselves these questions. Do you feel like you are unable to do the right thing? Do you feel like your values are being compromised? Do you feel like they're being undermined? Do you feel like you are unable to meet your professional obligations or be the kind of professional you know you should be and can be? Are you faced with new or extremely complex issues that are ethically challenging and you're feeling unsure about how to move forward? Ask yourself those questions. And then check in with yourself with the symptoms. These emotional symptoms: frustration, anger, anxiety, guilt, sadness, powerlessness, a loss of self-worth. Check in on the physical symptoms: headaches, heart palpitations, neck pain, diarrhea, muscle aches, vomiting. Check in on your psychological symptoms: social withdrawal, emotional exhaustion, depersonalization of your patients. And check in on the behavioral aspects. Are you engaged in addictive behaviors? Are you engaged in negative actions? Are you criticizing? Are you causing rifts? Check in. Check in with yourself. We know that moral distress can be related to compassion fatigue. We know this. We know it can be related to burnout. We know it can be related to depression. These are all things that can impact individuals, but they can also have an impact at the organizational level through patient safety incidents, distancing from patients, and that decreased job satisfaction, which may lead to employee attrition, people leaving their jobs, changing their jobs, and so on. So if this is what we might be experiencing, then what happens next? What ultimately happens? Well, the bottom line is that moral distress has the potential to undermine a nurse's sense of integrity, a sense of self. And when one's integrity is threatened, those negative feelings of distress prevent us from regaining composure, from developing a sense of wholeness and self-harmony. When we are able to work skillfully with these threats, because these are inevitable threats to the workplace or to our experience, when we're able to work through those, then you can restore your sense of agency. You can build your confidence. You can feel that you're able to deal without becoming overwhelmed. Moral distress may resolve to a certain degree, but it does not drop to zero. We still experience it and feel it. Unaddressed moral distress becomes highly problematic and can lead to all of those consequences. In extreme circumstances, our health begins to suffer. Our outlook on life has become negative because of just the impact of that overload or of the work. The signs and symptoms, the emotional, the physical, the psychological, and the behavioral, have become chronic. And we've developed physical illnesses as a result. At this point, burnout has happened, and brief interventions no longer help. Mental health day, a week's vacation, is no longer suitable. We need psychological and perhaps medical assistance. So burnout is associated with feelings of hopelessness, difficulties in dealing with our work or doing our job effectively. And these negative feelings usually have kind of a gradual onset, and they reflect the feeling that our efforts make no difference. Well, they can also just be associated with a very high workload or non-supportive environment. And again, I'm referring to descriptors from the professional quality of life screening. So what on earth can we do? What can we do? Well, We need to develop a self-care plan. And I know that self-care is, it's a trendy hashtag, but it is important. We need to develop a self-care plan that includes nutrition and sleep and exercise, and create time for and engage in activities such as journaling, doing a yoga session, walking the dog. We need to build self-care into our daily lives. We need to seek support. That might be a trusted colleague, a mentor, a leader, a virtual peer support group, a therapist. If you're really struggling with moral distress, you might want to reach out to an ethicist, to your licensing body, help you work through a problematic situation. Share your experiences, talk, share your feelings of distress, of guilt, your sense of unfairness and dis-ease. Share those at team meetings, communicate them, and exchange your stories with colleagues so that you can really get a sense of both your individual and your collective experiences. And seek help. Seek help from your employee assistance program. Seek help from your primary care physician. Seek help from your therapist, your psychologist, your counselor, your pastor, your spiritual leader. Seek help. There is no shame in asking for help. What else can we do? We can practice moral resilience. Well, what the heck is that, right? This is our capacity to sustain or restore integrity in response to moral complexity, to moral confusion, to distress, or to setbacks. Okay, I'm cool with that. It's an ability to bounce back. Interesting. How do we do it? Well, we become self-aware. Being aware of the clinical situations that produce moral distress for us, that produce that create personal triggers or activators, can help us become more proactive in responding to them. It can be very helpful for you to begin to notice your emotional landscape. What are your areas of vulnerability? What are your areas of resilience? What are the ways that your own history, your own experience influence your appraisal and reaction to troubling situations? What is the lens through which you filter the world? Once we learn the patterns of response that we have to certain types of patients, to certain types of diagnoses, to certain types of family characteristics, once we learn those patterns and we begin to understand those root causes, we are better able to foster self-awareness, and we're better able to explore our thoughts and feelings that accompany moral distress. And when we do that, we can become more willing to acknowledge that our own perspectives may be biased, that they may be incorrect, that they may be incongruent. When we approach ourselves, our perspectives with curiosity, well, then we have a better capacity for understanding any of the conscious or unconscious, positive or negative, assumptions that we may be using to guide our actions. When we repeatedly inquire into ourselves and look deeply into ourselves to determine whether our perspectives are truly relevant in the current situation, or if we're projecting our own bias from prior experiences. And when we're really truly self-aware, when we're truly honest and transparent with ourselves, we really do have a capacity to expand our moral awareness and to see those distressing situations with a greater clarity, greater confidence, and an ultimately diminished personal cost. Practice self-awareness. We can practice self-regulation. Self-regulation is something that a lot of us struggle with, right? We need to develop those capacities in order to really cultivate our ability to make good moral commitments, regardless of our fear or uncertainty. And when we engage in good self-regulation, we have the capacity to mindfully, intentionally notice and respond to signals from our body, to notice our emotions, to notice and respond to thought patterns in order to restore balance when upsetting situations or ethical challenges occur. When our nervous system becomes unbalanced or becomes reactive, we can become narrow-minded, judgmental, hyper-focused in the wrong areas, or we can experience intense self-doubt. And when that fear arises, we need courage in order to name, to notice, and release the source of our fears. We need to exercise, to build, to expand that self-regulation muscle. And practice that by practicing mindfulness. Engage in active engagement of tuning into our body's responses. When we practice mindfulness, mindful breathing, meditation, progressive relaxation, movement practices such as Tai Chi, these are all really great ways to help us move into a sense of self-regulation. Remember at the start of the session, we talked about breathing. Mindful breathing is a great way to get us into a place of self-regulation. Now, I mentioned moral courage a moment ago. So what the heck is that? Well, this is us, or you, being willing to voice what you think is morally right, despite the presence of barriers that could lead you to act in some other way. And that's taken from the American Nurses Association. Moral courage is a character trait. It is ultimately necessary for overcoming resistance, for overcoming a fear of rejection of morally justified actions. If we have moral courage, then we feel compelled to speak up, to speak out about those ethically problematic situations. You know, as nurses, you may need more, buckets loads more moral courage than some other people, particularly in situations when you have to break bad news or raise awareness of those unethical practices, or engage with team members or patient families with whom you disagree. Having moral courage allows you to discern boundaries, allows you to discern the boundaries of acceptable norms of practice, and it allows you to effectively articulate your alignment with your standards of practice and to effectively articulate infractions of those norms. Is it easy to get? No. Is it important? Yes. How do we find meaning? This is another way to build moral resiliency. We find meaning. In the midst of despair, it can be very difficult to find meaning when we're met with seemingly senseless situations. But when we find meaning in those situations, it can be an antidote to that despair. If the source of your moral distress is unmovable, work to stabilize your own emotions in order to neutralize any reactivity, any kind of response that you may have. Articulate your regrets, articulate your unmet expectations in healthy ways, by journaling, by engaging in good debriefings with your team, or good reflections, practicing good clinical supervision, mentorship. To the extent possible, find a way to release that moral residue, to let it go so that you can recalibrate to whatever a new sense of normal might be, someplace that restores your feeling of balanced heart and mind and a sense of wholeness. Yes, we have space for moral disappointment. That's important, a sense of moral failure even. But when we find the space to have meaning in it, it allows us to release that sense of powerlessness, that sense of despair, by really allowing us to reconnect with our core values, with our core intentions. When we reaffirm our values and reaffirm our purpose that originally drew us to this profession, it can help sustain us in these really ethical challenges, these conundrums. Similarly, if we practice connecting what we are grateful for in ourselves, in our colleagues, in our patients, in our profession, in our organizations. When we practice connecting to what we are grateful for, then we have a greater sense of meaning as well. So to do that, I encourage 3 gratitudes a day. At the end of your day, in your journal, write down 3 things for which you are grateful. And they don't have to be huge. They can be small. They can be tiny. They can be infinitesimal. Today, I am grateful that my nursing partner let me have a pee break, okay? It can be a small thing. Engaging in self-reflection and self-care is an important part of managing moral resilience. If you spend many, many hours at the bedside engaged in patient care, many, many hours in the community engaged in community care, many, many hours in administration advocating for patient care, this can give rise to moral distress. You will need time to reflect on the effect of your professional work, and time to develop good self-care practices, which we're going to get into in a few moments. Various codes of ethics, including yours, reinforce the moral mandate for good self-care, for caring for oneself. Our own personal strategies for reducing moral distress may include things like eating well, so meal planning, choosing healthy foods, getting enough rest. I know that sleep hygiene can be a problem. Limiting caffeine, and boy, I'm guilty of that one. And I know that when you're working long hours, when you're doing a night shift, when you're on your third 12-hour shift, that caffeine seems like a great go-to. But limit when we can. Limiting alcohol intake. Taking small, frequent breaks whenever possible. Doing these things are just scratching the surface. It will be important for you to find a more formalized, more individualized practice to lead to your self-care and to reduce your moral distress. I'm going to bring up another way in which we might increase our moral resilience. And this is one that doesn't always sit well with people, but I think it's important that we talk about it. And this is conscientious objection, because we are talking about morality. And this is the refusal by a nurse to participate in certain types of care based on the fact that these care activities violate your personal ethical beliefs. This is a hard one, right? And this is a tough decision that people will make. Live your values, okay? Live the values that you hold. Live the values that you hold that align with your inner character and align them with your outward behaviors. When we cultivate our ability to perceive ethical issues in complex cases, we are able to really execute robust moral agency. We are better able to explore what's important to us. And this allows us to have really, solid ethical competence. It allows us to have solid moral reasoning skills. We develop good habits, patterns of behavior that ultimately reflect our character. But this requires ongoing reflection, principled, responsible action, conscientious care to attunement with our values. This is a hard goal to reach, and it's a hard conversation to have. But when we attain new levels of ethical competence as nurses, you can have a greater openness to the values, motivations, hopes, and fears of others because you are comfortable and confident in your own and how your actions align with those values. This leads us to, excuse me, The final piece in moral resilience, which is engaging with others. How do we do this? How do we engage with others? We need to remember that we are not alone. People who have moral resilience leverage their relationships. They leverage their connections to support themselves. They leverage those connections to support others in developing integrity and developing that moral well-being. When we have strong social connections, they can act as a safety net for us when we struggle to address ethical complexities, difficult decision-making, and the sense of isolation that can often accompany moral distress. Develop a moral community by talking with trusted colleagues one-on-one, or with a supervisor, mentor, advisor. Reach out to trusted family or friends, obviously protecting privacy. Reach out to the leaders within your organization, within your institutions. Connect. Within your practice environments, it is critical that you feel safe to be able to look to others for support and seek support, as well as offer support, so that each of you is able to flex those self-regulation, those moral, ethical muscles. So what can you do during COVID-19? You need to meet your basic needs. We can talk Maslow all day long, talk about the hierarchy of needs. We need to meet those basic needs. We need to take breaks, whether that's getting up from your desk, stepping away from a patient, getting a glass of water, stepping out of your car if you're traveling. We need to take breaks. Maybe it's even taking a day off because you're overwhelmed. But we also need to stay connected, and this is through conversations, through a quick text, a phone call, checking in, reaching out, learning how to respect differences. We will all have the lens of our own experience that really does filter how we see things. And we need to respect those differences, and we need to stay updated without flooding ourselves with too much information or misinformation. We need to perform those personal check-ins, those self-check-ins, to see how we're doing. Check in with your head, your heart, your body, and honor the service that you're giving to our communities. Recognize it, value it. And then I'm going to challenge you to practice radical self-care. Radical self-care and self-compassion as the fruit of all of this. So what is radical self-care? Well, it's a return to our roots. The word radical means root. So we return to our roots. When's the last time? When's the last time you had fun? When's the last time you were truly and fully in your body? As children, we ran with our arms outstretched. We spun around in the field. We fully embraced tastes of our food or rejected. I have a 4-year-old, so there's a lot of food rejection. We embraced and relished the feel of wind in our hair, grass under our feet, feeling the cold water from a sprinkler. We knew when we were hungry without having to say it. We knew we were tired without having to whine. And we knew how to play. We knew how to laugh. We were ultimately in the moment. We were completely physically, viscerally living life fully. So many nurses that I see as clients can't remember what their last meal tasted like. Never mind what it was. They were so busy scarfing it down between charts, between meetings, between patients, between administering meds, often eating too rapidly because they'd waited too long to eat. They're over hungry, eating mindlessly, not eating foods they think are the best for their bodies because they're just too busy. They can't remember the last time they laughed, the last time they really had a belly laugh. And they feel guilty for taking any pleasure, even the simplest pleasure like a bath or a good book or, good heavens, both. Radical self-care is built built on the fundamental belief that you belong here, and that you are precious, that you are precious, that you have a right to feel good, that you have a right to health, that you have a right to peace of mind, that you have a right to joy, and that the whole world is better for having you in it. That's a lot, huh? So how do we do it? How do we practice radical self-care? Well, I've already told you, listen to your body. Check in with your body. Set a timer for 3 minutes. Sit upright in a chair or lay on a comfortable surface. Close your eyes. Breathe regularly at first. And then more slowly, get into that 4-7-8 breathing. Let your breath just kind of wander. And listen to your body. Is there anything that feels tense? Is there anything in your life that you are associating with the tension you're feeling or holding right now? Let the answer just rise to the surface. Be curious. Just listen. And then tune into your body and pay attention to how you want to feel. And pay attention to how you actually feel. And figure out how to hit the pause button. And when's the last time you gave yourself permission to pause? At some point in your careers or at some point leading up to your career, those of us in a caring profession ingested, assimilated, absorbed the belief that being a care provider means complete and utter self-sacrifice, not setting health boundaries, not setting any healthy boundaries on our well-being, not taking care of our most fundamental needs, including sleep, quality food, relaxation, hydration. This is not sustainable. This is not something we can continue doing. What happens when we deplete resources without any mind to sustainability? It's a catastrophe. It's an absolute catastrophe. We require sustainability as humans just as much as our non-human resources do. I'm challenging you to get good at giving yourself permission to pause. It's the secret sauce. Give yourself pause. You know, the top performing athletes, musicians, etc., successful entrepreneurs all know how to do this. They know the importance of making time to repair, recharge, and rejuvenate. This is the key to success, including success as a nurse, success in building moral resilience. So why do we find it so stinking hard to do? Right? Guilt, anxiety, the demands of external life. Give yourself permission. Give yourself permission by pausing for 15 minutes at the end of every day. Just 15 minutes. Eventually, maybe stretch it up to an hour a week, 1 full day a month. And this would be non-negotiable personal downtime for self-care. I wanted to share something with you that I encountered this week as I was preparing, or I guess a couple weeks ago. And I thought it was really powerful. And so I do want to share this with you. And I'm going to give a bit of a trigger warning. It does talk about engaging with patients in a code. So I want to just prepare you for that.
My name is Jonathan Bartels. I've been a nurse for over 17 years. Been in healthcare for 28. For 11, or mostly half of my career, I was a trauma nurse at a level 1 trauma center. I've since moved on. I'm now a palliative care liaison. But during my time in trauma, I created a concept called the pause. So the pause is a practice of just honoring someone who's passed and using silence to do it. It's nothing hard. It's not brain science. So before I did the pause and before I started to really implement it, You know, man, I would be banging to save a life, you know, doing the compressions, doing what I had to do. And then when we call it, we'd have to move on. And I would have to just walk away. And what I would do at that point would simply just be to leave that room and walk out and go to the next one, and take care of the next patient. It was difficult, you know, sometimes because I'd still be remembering what I'd done in the room before, and it would also affect, you know, how I'd interact, because this person coming in and they feel like they got legit suffering. They don't know what you just walked away from. But for me, it gave me a little bit of an edge, and I wanted some way to deal with that edge in a constructive way. But I knew that my people around me were also dealing with it, and they didn't necessarily have a voice. Instead of just walking away after it happens, or turning away from the body and turning away from the situation, we stop and we take a moment. You know, before we leave, could we just honor this person in the bed? Before all this went down, this person was alive. This person had a life, and now they're not here anymore. And let's also just in silence honor the work that we did, the efforts we put in, the care we provided for this person. And in our own way and in silence, take 45 seconds and just stand as a shared group and do this pause. And it gives us a chance to stop and just be present with that, so that we can put it down, so that we can walk away and walk into the next room and see our next patient or get our next call and go to that next call, be present for that person, and not just see them as a problem, but to see them as a person too.
I shared that with you because I feel so strongly that practicing the pause is an important part of developing resilience, an important part of practicing radical self-care. And I don't know how to make it stop playing. Pardon me. I'm going to figure this out. I think that looking at this video gives us an opportunity to really look at how we can practice radical self-care, how we can engage in seeing it not as a luxury, but as a priority. How we can find a way to really, truly be respectful and mindful of our needs, and understanding that as healthcare providers, that as nurses, you are important, and that self-care makes you more effective, not less. So John talked about the importance of the pause, and I really do want to reinforce how important that radical self-care truly is for you as nurses, as healthcare providers. Part of what I saw in John's video is a sense of hope. That yes, we're honoring people, but we're also honoring the experience of being the person who worked hard. And hope is an important part of moral resilience, of radical self-care. To have hope is to want an outcome that ultimately makes your life better in some way. It not only can help make a tough present situation more bearable, but it can eventually improve our lives, because envisioning a better future motivates us to take the steps to make it happen. And whether we think about it or not, hope is part of everyone's life. Everyone hopes for something. It's part of being a human being. Hope helps us define what we want in our futures, and it's a part of our self-narrative about our lives and the narrative that we all have running inside. In a way, having hope links our past and our present with our vision for the future. We have an idea, a vision for what we hope will happen, and that can include our vision for what our lives, both personal and professional, might look like. So practice hope. How do we do that? Well, identify it, name it. Recognize that hope is that match at the end of a dark tunnel, that moment of light. What do you hope for? Write it down, include it in your journal, and practice hope. As part of this, it's really important to set boundaries. Learn to say yes to yourself and learn to say no to other things. I wish I had realized a really long time ago. I wish I had realized a really long time ago how to say no and how important it really was for me to do that. Life would have been a lot easier. It would have been, in many ways, less complicated. If I'd given myself permission to set healthier boundaries, I would have maybe avoided burnout that I had a number of years ago. Thankfully, in these days, my overall healthy habits have kept me from any chronic health problems. But boy, oh boy, there are times that I have struggled with overwhelm and anxiety trying to meet too many demands. Learning to say no is critical. As caring professionals, many of us have been trained to be people pleasers. And saying no can feel really tough. It can feel wrong. Until you realize how good it feels to set healthy boundaries and stick to them. And as long as you feel good, as long as you are not overloaded, as long as you don't have that mile-long, impossible to-do list that is keeping you from eating, from sleeping, from feeling like you can even breathe, then those boundaries are working. Saying no to what you don't want leaves more time for the things that you do want. It leaves more time for you to recognize your needs, to build that resilience. So start paying attention to how you feel before taking anything on. Be honest, right? Again, tune into yourself. You might discover that you feel empowered to say no and that you feel less overwhelmed because you have fewer things on your plate. Remember when we started, I asked, what's on your plate? If you're not good at saying no, I'm willing to bet that your plate is piled high, like Thanksgiving dinner, but without the satisfaction of turkey stuffing and cranberries. If you're not good at saying no, practice saying things like, I'd like to think about that first, or I'll get back to you tomorrow or in a week, or what have you. Take the time to do a pros and cons list so that you can really digest what's being asked of you. Or you can say no with options. So thank you for offering me this opportunity. It's not right for me at this time, but I think I know someone who would be able to help you with that. And then make sure you ask the person you have in mind and make the connection. Saying no with options allows the other person to still feel valued while you respect your personal boundaries. And I promise you, you will not be missing out because you'll be gaining your own life, your own health, your own happiness. And those are worth so much. One more thing. Be kind. We are so often unkind to ourselves in so many ways, in ways that we would never be unkind to a child, to a vulnerable person, to our best friend. We're mean girling ourselves all day long. Repetitive negative thoughts. You're too much this, you're not enough that. You should have done this, you'll never be that. We just hear noise, chatter all day long. The clatter of our culture, the views of others, institutional voices, voices of authority. And it's just non-stop noise. Part of living a life that is full of radical self-care, that allows us to be resilient and to combat moral distress and compassion fatigue and burnout, is to recognize these automatic negative thoughts, recognize them as toxic, and replace them with thoughts of loving kindness for self. Understanding that we are all perfectly imperfect, we are all perfectly flawed, and we're all amazing nonetheless. We all want freedom. We all want inner peace, healthy bodies, healthy relationships, healthy lives, vibrant careers. It's about being kind to yourself and practicing radical self-care through radical self-compassion. We have the responsibility to take care of self first, before attempting to take care of others. And I know we have all heard, put the mask on yourself before you put a mask on someone else, in an airplane. The reality is, if we don't have the capacity to breathe, we're no darn good for anyone else. To beat the analogies, if our cup is empty, we can't help. We fill our cups first, and then we give to others from the overflow. And this is what gives us the capacity to heal. This is what gives us the capacity to counteract and balance the moral distress, the compassion fatigue, to build the resilience. So try this as an affirmation. I am nurturing myself first, as a way of creating capacity to care for others and engage wholeheartedly in life. Self-care is not selfish. And you, nurses of New Brunswick, are not selfish. You are nurturing, you are caring, and you are all equally deserving of that nurturing and care. There are so many ways to practice self-care. How will you engage in self-care today? What will you do to ensure that you're experiencing emotional regulation, that you are practicing radical self-compassion, that you are combating the effects of compassion fatigue and moral distress? How will you support yourself? What's your plan? Leonardo da Vinci told us that every once in a while, go away, even briefly, have a little relaxation, for when you come back to your work, your judgment will be surer. To remain constantly at work will cause you to lose power. This doesn't mean that we have to go away for weeks at a time. It can be going away in our brains for a moment to connect with self. It can be sitting in our car eating a sandwich. It can be breathing while we wash our hands. But however briefly, take a little relaxation so that when you come back, you are much more sure and ready to reintegrate into whatever the new normal looks like here in the province of New Brunswick. For surely it is different than the province we woke up to back in March. Thank you, nurses of New Brunswick, for your service. Thank you for caring for our population. Thank you for the work you do, for the sacrifice. But thank you most of all for taking care of yourselves, for connecting with your own needs so that you can be resilient, so that you can be the carers, so that you can nurture, so that you can show compassion. Thank you. Thank you for all that you do.